Good evening and welcome to Access COVID-19 Town Hall, Understanding the Facts. My name is Mona Mackey and I'm the director of the Access Community Health and Research Center, and I will be the moderator for today's town hall. Since the beginning of the pandemic, Access has been on the forefront. This month, Access began our community vaccine clinics. So far, we have vaccinated over 4,500 individuals. Through our experiences, we gained an understanding of how much misinformation around vaccines currently exists among our WhatsApp, Facebook, and other social media networks. This has emphasized the importance of holding this town hall to answer your questions and bring the information directly from our experts. We are proud to welcome our panelists from the medical and faith-based communities. We know our community has many questions about COVID-19 vaccines, and we are going to answer as many questions as possible. If you have questions throughout the talk, please use the Q&A feature to submit your questions. We will be monitoring the Q&A section throughout our talk. This talk will be recorded on our Facebook page and YouTube channels later this week. Please join me in welcoming our expert panelists. I'm going to start with Imam Brahim Kazaruni, who is the Imam at the Islamic Center of America, which is the largest mosque in the United States. He's been a phenomenal advocate for our community's health and well-being. We also have Dr. Osama Musallam, who is the Vice President and Medical Director of the Henry Ford Health System's International Initiatives. Dr. Musallam has been heavily involved in the COVID work at the Henry Ford Health System since April 2020 and currently leads the mass vaccination efforts in the community. We also have Dr. Adnan Munkara, who's the Executive Vice President and Chief Clinical Officer of Henry Ford Health System. He's responsible for the complete spectrum of clinical activities across the health system, ensuring comprehensive healthcare delivery, enhancing quality of care and patient safety. We also have Dr. Majid Shaman, who is the clinical professor in the Department of OBGYN at Wayne State University School of Medicine. He also works for maternal and fetal medicine at the Henry Ford Health System. We will begin today's town hall with a presentation from Dr. Munkara, who will help break down the science behind the vaccines and hopefully answer many of your questions. Dr. Munkara.
Thank you, Mona.
For being with us.
Thank you, Mona, and good evening, everyone. It's a pleasure and honor to be with all of you, and we are really so privileged to have Imam Kazaruni with us to address some of the things that are important as they relate to vaccination in our community. I'm going to start the presentation. I'm going to ask both of my colleagues, Dr. Musallam and Dr. Shaman, to present some of the data and topics that we'll be talking about today. This will be kind of a joint presentation. Over the next 20 minutes, we'll present you some of the data, and then we want to really open it for questions that both the Imam and we will be able to kind of address depending on the type of questions we are looking at. Do I have the control of the slides, or do I ask you to next slide, please? Here it is. I have, yeah, I think I have it. Okay, first talking a little bit about COVID vaccine safety. We know that there have been a lot of questions, have the discovery of the vaccine being cut short, and have all the measures that we usually take for vaccine development made in the right way? And the reality, yes, all the research that is needed to get us to where we got to with the vaccine was done exactly the same way that any vaccination will go through. The reason it was accelerated is that the effort as well as the resources that were given to develop that vaccine were accelerated because the federal government spent a lot of money to make sure that we have the science that is done in that respect. In addition to that, the production of the vaccine was accelerated because most of the time companies do not start producing the vaccine until they know it is effective, because if it is not effective and they start producing the vaccine, they lose a lot of money. However, the federal government made a decision that even when they were doing the research, they ask the companies to start producing the vaccine, and they will pay for it. And if it is not effective, then they will not kind of deploy it. With the idea is to make sure that the vaccine reaches all of us as soon as possible. And this is what happened. This is why we got the Pfizer, the Moderna vaccine that were accelerated in their production. But the research itself was done exactly the way that we would do any research, and tens of thousands of people were enrolled in the trials that involved the Pfizer, the Moderna, and Johnson & Johnson. We were fortunate, as well as we are proud at Henry Ford Health System, that our teams, in fact, were involved in both the Moderna vaccine trial as well as Johnson & Johnson trial. So we were kind of excited about that. With respect to the technology behind the vaccines, the Pfizer and Moderna have used the same technology that's called mRNA, M standing for messenger RNA vaccine. And people are concerned, well, does that mean that it's going to change my DNA, my genetic code, my genetic material? It does not. All what it is, the mRNA is a small genetic code that is injected and goes into some of our cells. It does not go into the nucleus. It does not get anywhere near our genetic material. However, it gets into our cell. And our cell is able to manufacture, using the genetic code, it manufactures a protein that is specific for the virus. It's called the spike protein. That spike protein is what induces immunity. It's what causes our body to recognize that there is something wrong, and I'm going to kind of raise antibody and prepare my system to kind of fight that antibody. It is not any different than when we get exposed to a virus or to a bacteria. Our body recognizes it and fights it. What this mRNA is doing is letting our body make the protein, not the whole virus, just a part of the virus. And that part of the virus is seen by our body as representing the virus. And as such, our body develops the antibodies against that virus. So this is how the mRNA works. And this is a technology that has been now studied for many, many years. This is nothing new. It has been researched in a lot of areas, including cancer. And we were lucky really to kind of make sure that we have two vaccines that were able to be developed in that respect. The Johnson & Johnson vaccine is a little bit different. It is very similar to how we use the flu vaccine, and it is usually taking, again, part of the genetic material of the virus itself, of the coronavirus, and putting it in a different kind of virus that is harmless to our body, and that virus is injected into us. And then that virus that is injected into us, it does not cause any illness in us, but it serves like a vehicle. It is like, think about it as the car that is taking kind of that part of the coronavirus and again gets it into our cell. And by getting it into our cell again, some of our cells in our body manufacture that protein, that spike protein, based on the genetic material that we had in them. And accordingly, our body starts seeing that protein, start raising immunity to that protein, so that if we get exposed to the virus, if we get exposed to the coronavirus, our body now has the protein, has the immunity to fight the virus. And this is how we are able to fight the virus when we are injected, either with the Pfizer Moderna vaccine, which are mRNA vaccine, or the Johnson & Johnson, which is a viral vector vaccine. As I mentioned earlier, there were no shortcuts, no corners were cut, no shortcuts were made in the development of the vaccines. All vaccines went through the whole phase trials and research that needs to be they have to go through. They went into the three phases, what we call phase 1, phase 2, phase 3. In phase 3 trial, this is when people get either a vaccine or a placebo, and you determine whether the vaccine is both safe and effective. And all the trials have shown that the vaccines are both safe and effective. And then after the companies do these trials, they have to present them to a committee of experts, and these committee of experts are representatives from different parts of the nation. These are experts in infection, in vaccination, in safety, and where there are also representatives of the community. They look at that data, analyze it, and this is how they make the determination whether to allow the use of the vaccine. And usually the first allowance is made in the form of emergency use authorization, as we've seen with most of these vaccines. whatever reason, it's not advancing for me. Here it is. We talked about this slide, so I'm going to go to the next slide. As we've mentioned, mRNA has not been only used in the coronavirus development for Pfizer and Moderna, but it also has been used for other vaccination as well as in cancer treatment. So this is a technology that is extremely well established. It is not a technology that is very novel. It is new in the vaccination world because we are applying this vaccine, but this is something that has been existing now for years. Next, please. And the last thing I am going to touch on is people are asking, well, if I am getting the genetic material of the virus, am I going to get the infection? No, we are not going to get the infection, because the reality, what we are getting is we're getting just a small genetic code of the virus, just a small part of that protein. We are not getting the virus itself. We are not getting the whole genetic material of the virus that causes the infection, that gets into our body and causes our lungs to fail, or causes our other organs to fail. So there is a significant difference between what we are getting with the vaccination and what the virus is about itself. And this is why there is absolutely no concern by getting any of these vaccines that we are going to develop the infection, the infection. In fact, what we are going to do is develop the immunity so that when we are exposed to the vaccine, we are not developing the infection. I'm going to turn it over to Dr. Shaman, who is going to talk a little bit about side effects in the general population and specifically in women and in pregnant women. Majid?
Thank you, Dr. Makara. Again, it's a pleasure and honor to be joining the webinar and to be with our panelists today, Imam Kanzouri, Dr. Makara, and Dr. Musallam. Thank you, Mona, for the introduction. I'm going to talk just briefly about the vaccine side effects. What are we expecting? And then I will touch briefly also on the concern of using the vaccine in patients who are planning to get pregnant, pregnant patient, and also in patients who are planning to go for breastfeeding. Do I have the control to advance the slides? So let me see if
I'll be taking care of that.
Okay, yeah. The side effects that we usually anticipate when anybody take the vaccine, you can actually see these are the common side effects, which is the most common, I would say, the injection site pain and swelling. That's across the board if you are taking either the Pfizer, Moderna, or Johnson & Johnson. Other side effects, fatigue, headache, chills, fever. And if you think about it, these are side effects sometimes we get when we have any vaccine, including the influenza vaccine. So this is what we call in medical term flu-like symptoms. So these are maybe the most common. Some other kind of symptoms that some people will experience is joint pain, nausea, some delayed swelling and redness at the injection site. And also some people might have some swollen lymph node, and we'll talk about why it is kind of important to recognize that some people will have the lymph nodes, because we'll talk about mammogram. Next slide, please. The side effects, usually we anticipate these side effects within 1 to 3 days after vaccination. Most of these vaccines, you will see these side effects the day after taking the vaccine. More significant after the second dose. That's for Pfizer and Moderna. Second dose because in Johnson & Johnson is only 1 dose. It's more common in younger people. We don't see maybe more severe symptoms in older, when they define it as maybe people over the age of 59. About 2% may feel ill enough to limit some usual activities, but that's only a small percentage. If these side effects persist, take a day off work following vaccination. So some people will kind of plan it ahead, and they will either kind of take it over the weekend, or they will tell their employer that they might not be able to go to work the day after. The single most common side effect from vaccination is a protection against COVID-19 vaccine. And that's why you're maybe getting some of these minor side effects is just your body is producing, as Dr. Munkar mentioned, the immune system that give you the immunity against a COVID-19 infection. Next slide, please. Some of the things that you can do to relieve the symptoms, you can put a very cool, wet washcloth over the area and where you got the injection. That sometimes help with the pain, with the swelling. Take Tylenol, and this is very important, after the symptoms appear. Okay, don't take the Tylenol to prevent the symptoms because we hear it now from our family, friends in the community, our patients. They're saying, "Oh, I'm going to take Tylenol just in case I will have any, symptoms related to the vaccine." But do not take the Tylenol or do not take any kind of NSAID because that might decrease some of the immune response, which you need to have this immune response to develop immunity. So we only, recommend taking the Tylenol after you develop these symptoms of maybe fever, other kind of symptoms that the Tylenol might alleviate. And I want to emphasize from pregnancy situation that Tylenol is safe. So if you're pregnant and you took the vaccine or you're planning to take the vaccine, and if you have any of these symptoms, it's absolutely safe to take Tylenol. We know that we should not take any NSAID during pregnancy. If the symptoms are not going away, and remember we said most of these symptoms last for 3 days, definitely maybe you need to contact your doctor to just see what else going on, and just to kind of have maybe further workup or watch your symptoms closely. Get the second dose, even if you have symptoms from the first one. So some of us will have some symptoms. It's kind of very, if you have these symptoms, doesn't mean that, oh, I shouldn't be taking the second dose because it's going to get definitely worse. No, it's actually your body, again, is producing all this or immune response to give you some protection against COVID-19. And just as I said, a plan to take your second dose unless your doctor tell you not to take it. Next slide, please. Now we talk about like some special population, and of interest, definitely pregnant patient. Pregnant women, we'll talk about, pregnant women maybe in the next slide. When we basically talk about, I see a pregnant patient, in our offices, and they always ask about, should I take the vaccine? Always, you have to weigh the risk and benefits. If I don't take the vaccine and if I have COVID infection during pregnancy, is that worse if I'm not pregnant? Yes, we know that, pregnant patients who get COVID infection, they have more kind of severe symptoms. They have more maybe risk to go to the intensive care unit, to be sick, to have some what we call mechanical ventilation when they have the tube and to help you with the breathing. Unfortunately, slight increased risk of death and some pregnancy complication like preterm labor and miscarriage. So you look at the risk if we don't take the vaccine, and if the patient get COVID-19 vaccine, that's something that you need to talk to your, OBGYN if you're pregnant. Pregnant women, our societies, and again, I will discuss it with the next slide, definitely say we should not withhold the vaccine in pregnant patient, and the same thing for breastfeeding women, because we don't have evidence to show that the vaccine is harmful for mom or baby. Same thing with immunocompromised. Some concern that they might not mount a strong, response, but they still should actually have the vaccine, because this group of, patients who are maybe immunocompromised, they have higher chance of having serious illness if they get infection with COVID-19. And that's why definitely the recommendation is they go ahead and take the vaccine. Again, it's not a live vaccine. Same thing with patient with autoimmune disease. You have patients who have different kind of medical condition like lupus and other kind of autoimmune disease, and they think that if I take the vaccine and if I produce an immune response, that might worsen my, my autoimmune disease, but that is also not proven to be the case with COVID-19 vaccine, and they don't trigger any flare-up. Next slide, please. These are the recommendation from the ACOG. It stands for the American College of Obstetric and Gynecology, and that's the society that actually give the recommendation to all OBGYN across the United States. So they have, recommendation about everything when it comes to pregnancy, after delivery. And these are exactly their statement regarding COVID-19 vaccine, that number one, the question, does COVID-19 vaccine will decrease my risk of infertility? That means to get pregnant, right? And there is no scientific proof that it will affect fertility or getting pregnant. We should not withhold from the vaccine from pregnant individual. So that means if we have pregnant patient, they come in and they ask what is the risk and benefit, and if they want the vaccine, we definitely can offer them the vaccine. Same thing for patients who are planning to breastfeed. So for lactating individual. And again, a conversation should occur between the doctors and their patient, just to talk about safety and efficacy of the vaccine during pregnancy. So just to kind of summarize it, our society and almost even the high-risk society have the same kind of recommendation when it comes to pregnant patient and lactating patient, that we should offer this vaccine or the COVID-19 vaccine to pregnant and lactating women. Next slide, please. So these are some of the questions. If I'm breastfeeding, can I get the vaccine? We already talked about it. We still think that our patients who are breastfeeding, they're okay to take the vaccine. Is the vaccine going to affect my fertility? This has been, refuted, and it's not definitely clinically correct. I would say that it will affect your fertility or getting pregnant. The COVID-19 vaccine and false positive on mammogram. You remember one of the things that we talked about these lymph nodes, which are structures in our body that it sometimes help to fight infections and sometimes get swollen in patients who have breast issue, including breast cancer. So we recommend that the patient, if they get the COVID-19 vaccine, they should wait for 4 weeks after receiving the last dose and get their mammogram if they're eligible for the mammogram. I think the next portion of the presentation will be for Dr. Musallam. So we can actually switch.
Thank you, Dr. Shaman, Dr. Moncada. It's a pleasure to be here with this esteemed panel, and thank you for the invitation. So I'll be brief because I know we want to get to the Imam and hear his important thoughts. But just to give you a little bit of a sense of what we've done, this is Henry Ford Health System. Essentially, we started vaccinating people or giving the doses on December 17th. And through yesterday, we've actually given over 185,000 doses, completely vaccinated 85,000 plus people, meaning they've gotten both regimens, a 2-dose regimen. And we've actually had very, very little adverse effects, very little reactions, and I'm happy to share some of that information. The Johnson & Johnson, as many of you may be aware, did not come into distribution until this month, and actually distribution has been delayed. And we have received very, very limited quantities, less than 1,000. And so we currently are, for the most part, using Pfizer and Moderna, a significantly larger number of Pfizer because we have the super cold freezers. Next slide, Mona, please. So, from a perspective of who should not take the vaccine. So we think everybody should take the vaccine except for the following people. Right? If you have had a severe allergy to a previous dose of COVID-19 vaccine, so you've received 1 dose and had a very bad reaction that a doctor told you was life-threatening or was anaphylaxis, you should not take the 2nd dose. Or if you have a severe allergy to any vaccine ingredient, so if you're somebody who's can't take the flu shot, for example, a pneumonia vaccine because you've had severe allergies to those vaccines, then we would actually advise you to wait and consult with your physician or an allergist specialist in allergy medicine before you take the COVID-19 vaccine. We've listed this here, and I'm sure our colleagues at Access will share this as far as looking specifically for what those ingredients are, because often people will ask you if you're allergic to an ingredient in the vaccine. So we would advise you to go and take a look at these and maybe write them down so you know if you're allergic to any of the ingredients. And it's actually a small number of ingredients in each vaccine. You should probably talk to your physician. It would be really helpful to talk to your physician to say, you know, should I not take the vaccine if you have any of the above, or if you've had allergies to any intravenous medication. So if we given you medicines in the IV or in the muscle, and you've developed a bad allergy, a severe allergy that required life-saving interventions or medications, then that should have a conversation with you and your physician before you sign up to take the vaccine. Otherwise, everybody else should be really signing up to take the vaccine. There's no medical reason not to take the vaccine outside of these. Next slide, please. So just to round that out, if you have, you know, allergies to foods, if you have allergies to pollen or dust, if you have allergies to medicines that you take by mouth, makes you sick, you might get a rash. If you're allergic to pets and or pet dander or certain plants, none of those things are serious concerns for us. And so we believe you should take the COVID-19 vaccine when it becomes available to you. None of these reasons are a reason not to take the vaccine. Next slide, please, Mara. Now, I know there's a lot of recent conversations and a lot in the news about these new strains or variants of the COVID-19 itself. And so one of the things that happens, especially when we have a pandemic like this, where there's lots of people that are sick, and basically what that says is that there's lots of circulating virus, easy to catch, many people sick, they replicate this. So it is natural that the virus will start to mutate. This is a natural thing, it's a natural occurrence, and we expect these mutations. And so basically we have these new variants that have come up, the B117 UK, that's in England, the B135 that came out of South Africa, and the P1 from Brazil. So the viruses are always changing. That's a common occurrence. These variants suggest that they actually make the virus spread more easily and much quicker, right? So that's why we continue to advise people to wear masks, even if you're vaccinated, because not everybody else is. I think what we're really looking for is we're looking to see what happens with these. Are these, making people more sick? Are they making more people die, more? Are they making more people sick, right? And so, or severely sick, or catch it quicker? There's some research that suggests maybe the UK variant is doing a little bit of that, but obviously we are still researching and we're looking for studies that are coming out to tell us how bad some of these variants may or may not be. What's really important to note is that the vaccines, based on some of the research, the Johnson & Johnson vaccine was studied later when some of these variants were actually in circulation, suggests that our vaccines are actually effective against these variants. You might hear that somebody's immunity may not be as high, or the response, our immune response to a vaccine may not be as high or be as active against one of these variants. But what we've seen, and obviously we're looking for more evidence as more and more research comes out, is that all of these vaccines appear to have activity against these variants. And so again, the 3 vaccines that are available in the United States, Johnson & Johnson, Pfizer, and Moderna, have activity, are effective against everything that's out there thus far. So no reason not to take the vaccine. Next slide, please. So you have many options for getting a vaccine. Obviously, Access is working really hard, and we're so proud of them to have already vaccinated 4,500 people, 4,500 people. Great job, Access. Mona, your team has been amazing.
Thank you.
We're fortunate to have helped out a little bit. We have partnered with many folks, as I'm sure many of you have seen the news. We've partnered to provide medical oversight and direction at the the first very large FEMA, that's the Federal Emergency Management System. It's a federal site at Ford Field that actually started today. About 5,000 to 6,000 doses available there every day. So what you see on the screen, and we'll share this again, to make an appointment. It's open to everybody. I think one of the nice things about this one, just like at Access and others, nobody's checking for insurance. There is no fear of, there's no law enforcement there that's looking or checking people's IDs. And so the idea is to get people vaccinated. That is the most important thing. We have done a lot of work. Like I mentioned with Access, we have the great privilege of having a Monday clinic at the Islamic Center of America, where we provide doses there. So thank you to Imam Kazaruni for allowing us to come in and partner with you to take care of our community there. We have many vaccination sites elsewhere. One of the important things I want to mention is that at all of these places, at Access, at the Islamic Center, or at Ford Field, you really need to reach out to those institutions, as we Henry Ford Health System can't make those appointments for you. We look to them to make those appointments, and Myers making the appointments for the Ford Field mass vaccination site. Next slide, please. So look at all of your options. Lots of places are doing it. Wayne County, you might have heard of, has been doing a lot of these. Oakland County's doing a great deal. All of our local health departments are working. Our fellow and sister hospitals and health centers and health systems are also working really hard to vaccinate their patients. And so multiple opportunities. And then obviously there's a ton of, right now you see Meijer, Rite Aid, Kroger, Walgreens recently, CVS, all have vaccine and have been distributed vaccine. And so the Michigan.gov website is a fantastic resource. I was just on it before we came on, and we'll tell you how many people, where to go, numbers, lists to get on. So we encourage you to go ahead and actually sign up. We know that the state of Michigan is getting more and more supply. And so there will be plenty of opportunity to get vaccinated. And the sooner you get vaccinated, the sooner you will be protected, the sooner you'll be able to see your loved ones and protect your loved ones as well. Next slide, please. Again, so looking at if just in the state of Michigan or in Southeast Michigan, right, there's about 20% of us that have been vaccinated, which means that there's still 80% that have yet to be vaccinated. And so the vaccine does give us lots of protection. Studies suggest that it actually protects us from getting the disease and maybe from spreading it, but it's not 100%. And so what we really need to tell everybody and remind ourselves is that we have to wear our masks. We have to keep our distance. We have to wash our hands as much as possible, because not only are we protecting ourselves, but we're protecting our loved ones. So meaning you can still potentially bring that virus into the home environment or get your loved ones sick if you're not staying safe. So I don't want anybody to get a sense of, overconfidence or reassurance after you've been vaccinated. Yes, you're protected, but everybody else has to be vaccinated for all of us to be protected. And obviously, as we get more and more of us protected and vaccinated, we'll learn more about how things are working and how much we can let our guard down, or we can start to go away from these recommendations. But currently, CDC, Henry Ford Health System, every specialist and every person I've spoken to who deals with vaccines and with infectious disease absolutely wants you to continue to wear your mask and social distance and wash your hands. Next slide, please. Testing is really important. If you feel sick, Dr. Shaman went through some of the side effects. If you have a bad fever that lasts more than 2 days, if you start to cough or feel short of breath, you might have still picked up the virus, right? We actually have numbers and figures. Again, remember that some of these studies have suggested, maybe 95%, 94%, 86%, whichever one you're reading, effective against disease. It doesn't mean that they protect you 100%. So even if you've been vaccinated, you still could potentially be sick. And so testing is really important. If you have any of these symptoms, please go ahead and get a test. It's really important to know. And obviously you want to protect your loved ones, your family members from picking it up. So here's some information for you, and we'll share this with you as well, to go ahead and get a free COVID test whenever you need it, whenever you have symptoms. If you develop any of these symptoms, we urge you to call your doctor, discuss it with a healthcare professional, and I'm sure they'll be telling you what we would tell you. Let's go ahead and get a test and make sure you don't have the disease. The next slide, please. So more information, and I'll quickly end here to talk about, where we said the Michigan.gov, we referred you to our Henry Ford Health System website. Here's the CDC website to confirm everything that we've said to you. I think we'll stop here. Mona, give it back to you, and want to please bring the Imam to share his thoughts.
Thank you, doctors, for that very insightful presentation. I can tell you that you already answered a lot of the questions that our community was asking. So again, I want to thank our audience for joining us today. We received a number of questions about the safety and science behind COVID-19 vaccinations. We will answer as many questions as possible. If we don't get to answer your question, please email Mona Beydoun and we'll get a response to you. Her email address is in the chat. We have Imam Kazerouni with us, and we want to be respectful to his time. He has another commitment, and grateful for your time, Imam, and for being with us. So we're going to start with you. As the holy month of Ramadan is approaching around the corner, can you receive a vaccine during the month of Ramadan when you're fasting?
Well, thank you very much, Mona, for the invitation. I'm grateful to the fellow panelists for all the science. So I'm going to leave the science aspect of it for them to address. And I'll focus on a few of the religious aspects that recently have been kind of floating around. First, let us establish a ground. All scholars, jurists have primarily two principles that they rest their opinion on. Number one, when it comes to receiving any injection, whether it's vaccine, intravenous, or anything else, the first question is they will ask to find out whether the ingredient is food-based or somehow vitamins or any kind of stimulant. If they are not, then technically under the first normal condition, it's okay. And the second one is what kind of an override mechanism. And what do you do, which is they use the principle of la darar wa la darar. What do you do under special circumstances, even if there are traces of them? Under the current information available, from what I have been told and what we have asked various scholars, they all have agreed that use of the vaccine is not going to negate the fast. And particularly in the light of the possibility of harm and protecting themselves, some of them even have said that it is an obligation, that if the vaccine is available for you, go and take it. So it's not going to negate or somehow disrupt the fast if it happened that the second vaccine falls within the month of Ramadan. Because I stand to be corrected, I'm sure, so far from the research that I have done, there is no food substance that to the amount that increases the stamina, or a vitamin substance. It's a unique chemical that is being used. So there is no fatwa or opinion, juristical opinion at this stage that says it is forbidden and they shouldn't do it.
Thank you, Imam Kazerouni. And I know that the Islamic Center has also been on the forefront of providing vaccines in partnership with Henry Ford Health System. Why is getting vaccinated so important for our community members? Well,
I think the answer to this question has already been clearly stated by the science, as well as the doctors, the fellow panelists, that the choice is between clear harm and literally in some cases might be loss of life, and the vaccine. And I don't think there is any scholar that would say that not to go for the vaccine. I understand. Last Friday and a couple of Fridays before, I made it clear that vaccine constantly, I have done that, encourage the community to go and take vaccine, and even repeated the city of Detroit's numbers that they can call and schedule an appointment, and the age limitation, etc. Because it is a critical issue. As the doctors have already identified, 80% protection means nothing if only 20% of the population are taking it and 80% are not taking it. So we are at risk. me and there are other colleagues here at the center that other people might be feeling bold, but I really have to be extremely careful in where I go and how much sanitization and everything else necessary steps to protect myself and the family. So it's really not a choice. It's an obligation, because I remember we sent an istiftah early on last year to the offices of the Grand Scholars with regard to the issue of masks and sanitization and everything else. The issue was the same, or the answer was the same, that if it protects people from catching the disease, then it is an obligation.
Wonderful. Thank you so much, Imam Kazerouni, for being with us today, and your insights, and for all the amazing work that you do in the community. Thank you on behalf of Access for
You are
being
very
with
kind,
us
sister.
today. Thank
And
you.
thank you. My gratitude and thank goes to the other panelists, Henry Ford and others, that they really provided these vaccines to the Islamic Center and other places that opened up the opportunity for people. And I didn't expect it will be such a torrent that as soon as they realized the Islamic Center is registering, and it was call after call after call that people wanted it.
It was an honor.
Well,
to
thank you
partner
very
with
much.
sir.
Thank you,
Thank
Imam
you.
Kazerouni. So we have
Thank
a
you very
question from our audience. I think is a very good question. Do we have any data on how many people have died from the vaccine? And if so, which vaccine people have died from? So as we know, there's a lot of concern around, we've seen cases where people reported after the vaccine that they have died. I know there's no scientific evidence right now linking the two, because I believe these are still under, being studied at the moment. But what are your thoughts, doctors, on that issue?
I can start and with that response, and then my colleagues might be able to also add to some of the thoughts we've had. So I can, as Dr. Musallam has mentioned, we've given now over 185,000 vaccines. Obviously, we've given them to all segments of the population. We've got some healthy people have gotten them, some sick people have got them because we've given them to many of our patients. And as you can imagine, sometimes when you have sick patients, you have patients die because of their disease. We have patients who had cancer. We had patients who had big blood clots end up dying. And the few cases where we people have been vaccinated and there were death events, we looked back in details at those cases. And we could not attribute any of these to the vaccine. There were other causes of death. When we look at the research and the data that has been published, similar to what you have mentioned, Mona, is that all the data shows that the death that might have been reported are coincidental death. There is no association, there is no proof that the vaccine caused an illness or an event that led to the death of that individual. The side effects that we have witnessed are very, very small percentage. And Dr. Musallam, because he is on top of that data on a regular basis, will be able to provide more. But I'm not aware that it might be that we had one individual out of the 180,000 doses that had a side effect that needed to be in the hospital for a day or two. But all other side effects were managed in an outpatient setting, meaning that they are minor. So we don't have, based on the data that's published as well as our data, we don't have any evidence that there is a cause of death. We continue to collect that data. We are obligated, and we continue to do that our infection disease expert, anytime we have this side effect, we report it so that it can be aggregated, reported to the CDC and to the FDA so that they can keep aggregating it and informing the public about that. Sam, you might want, I know you are on top of this on a day-to-day basis with respect to the numbers.
Yeah, thank you, Dr. Mukhar. Dr. Mukhar is absolutely correct. We look at every single case where there's a reaction, mild or otherwise. I can tell you our figures are essentially a little bit less than 1 in 1,000 people who've received the vaccine will have a reported reaction that's significant enough that they've told us about it, or we've heard about it, or we've had to give medicine. So less than 1 in 1,000 people, to help reassure people that the vaccines are really, really safe. And this is our experience with Moderna, Pfizer, and a little bit with Johnson & Johnson. As Dr. Mukhar said, Every single case is reviewed by a panel of specialists, infectious disease specialists, vaccine specialists, and we actually have to write this up and report it to the federal government, because obviously these are still all under significant investigation. And I can reassure you that there have been no deaths in the state of Michigan that we're aware of because of the vaccine, and absolutely none from the vaccine with the 185 doses given at Henry Ford Health System.
Thank you, doctors, for shedding that light on this issue, because it's coming up very often, more often than not, as a concern for many people. So thank you so much for sharing that very important, critical piece of information for our audience. Another question that continues to come up: will the vaccine give you a health condition or hurt you in the future? Are there any long-term effects that have been noted?
So couple of things to that response. We know that the phase 3 trials on both vaccines, and now we add the Johnson & Johnson. So there are probably in excess of 100,000 people who have been, gone through the research and where the data shows to us what the side effects of the vaccine. Would the vaccine give us long-term side effects in 2, 3, 4 years from now? There is nothing in the science to tell us at the present time that this is the case. But we need to be realistic. We've not had these vaccines for 2 or 3 or 4 years. It's like any new medication. You get the medication, and I cannot predict what will happen down the road. What we can predict is based on the science and what the science and the testing has told us so far. And we know for a fact that this is not the case. But I will turn things around. I will say, does COVID cause long-term effects? And what we are learning at the present time is that people who have got COVID, although some of them, many of them have recovered, there are people who are having long-term side effects. There is scarring of the lungs. There is effect on the heart. There are other effects that we are starting to see. There is effect on the brain that is related to the COVID. So when people argue to say, well, we don't know the long-term effect of the vaccine realistically, yes, we don't, because these vaccines only have been given now for the past year. We don't know what it is. We know the science tells us that they seem to be safe. But what I tell people, what we know for a fact, that COVID is causing long-term side effects. And these long-term side effects might be permanent, and we need to be very cautious about it. So this is why when we're talking to what my colleagues have said, balancing benefits and risks when you are doing anything in medicine, when we take a Tylenol, the Tylenol has a side effect. Does it have benefit? Does it have risks? Balancing these things, there is no question that the vaccine at the present time win that balance.
Exactly, Dr. Moncada. I can't agree with you more, especially for individuals who have, chronic health conditions. And those are the folks that we see the long-term impact if they end up getting COVID. So again, it's very, very important for people to get out there and get vaccinated, and weighing the risks versus the benefit. So our next question, Dr. Shaman, I know you touched on fertility and indicated that there is no evidence to show that the COVID vaccine has any impact on that. So do you recommend that people, pregnant women or women who want to get pregnant, consult with their OB/GYN if they have issues or concerns? I mean, how do we navigate around that? Because that seems to be a big concern for individuals who strongly believe, for one reason or another, that there is somehow that it's going to impact their ability to get pregnant. So any last minute thoughts on that? I just want to make sure that our audience have the information that they need.
Yeah, thank you, Mona, for the question. And I know this question is gonna come up and is gonna keep on coming up, because that's what I actually hear every day from all our patients. So let's kind of take it like, patients who are trying to get pregnant. And as I said, there is no evidence that patients who are getting the COVID-19 vaccine, based on the way it's made, based on the things that we are seeing, that it's affecting fertility. And we're definitely, as Dr. Moncada said, the more time passes, we'll have more patients that they are going to get pregnant, or more women they're going to get pregnant, and then we'll have maybe a whole full picture about fertility, but we don't have any evidence. One thing that I want to clarify, that if you have you took one dose of the vaccine, we're talking about Moderna and Pfizer, and then happen that you have a positive pregnancy test, that you should go ahead and take the second vaccine. second dose, because that's something that I see that patient, they say, I'm now pregnant, I cannot take the second vaccine, the second dose of the vaccine. I will definitely recommend that they will finish the full course of vaccination. Now, regarding pregnancy, we have some data because even with the initial Moderna and Pfizer, they have some participants that they didn't know that they were pregnant and they were part of the trial, and then they became pregnant. And now we have more than 30,000 pregnant women that they got the vaccine and they kind of reported to the reporting system. And currently we have some preliminary data that there is no increased risk of any of the complication that sometimes we hear. Miscarriages, like stuff, congenital anomaly, that means something happened in the development of the babies and they will develop some defect in their organs. No other kind of complication that we are seeing in mom, like in sense of, putting them at a higher risk. And I cannot agree more with Dr. Munkara. Let's kind of talk about if you have COVID-19 vaccine, COVID-19 infection or corona infection during pregnancy, what is the risk? The risk is tremendous. I mean, in Michigan, especially in Detroit, we took care of a lot of patients who have maybe COVID infection and they're pregnant. We know that there are changes in pregnancy that makes your lungs, right, maybe does not accommodate insult, which happens in COVID-19, plus your oxygen consumption. The oxygen need is higher in pregnancy because you're pregnant, you need more oxygen. So unfortunately, a lot of, pregnant patients who got sick, they end up, as I said, going into the intensive care unit. Some of them, they have more severe kind of complications. So as of now, we don't have any evidence. I mean, the vaccine, even the way it's manufactured, it does not, the mRNA, it does not really leave, and we don't think even crosses the placenta. So if anybody is worried about this, mRNA might go to the baby and it can cause like some kind of issue. It's just the way it's manufactured does not really across the placenta. The same thing with the Johnson & Johnson, because I know it's called like a virus that will take the protein into the body, but that virus does not replicate. Think about it only, as Dr. Munkara said, it's just a vehicle that does not cause any infection, does not really replicate and cause any issues. So as of now, again, I will say no issues with fertility. We should still, when we talk to our pregnant patient, we should offer them the vaccine, and we don't have any evidence that it's causing any issues. And the same thing for our patient with breastfeed is actually when you take the vaccine, you might actually, if you breastfeed, these good antibodies that protect you from infection, it actually might pass on to the baby, and your baby will be maybe protected. That's the same concept that we've been using for influenza vaccine that we've been giving for many, many years. We tell our pregnant patient, I give you the influenza, it may benefit you, but also it will benefit your newborn because you have these antibodies, which is the structures in our body that will fight any infection that pass on to the baby. So kind of, just to summarize it, if you're pregnant, trying to get pregnant, any patient or, breastfeeding, you should consider taking the vaccine.
Thank you so much, Dr. Shaman, for elaborating more on that, because I know our audience are really curious and want that information. Thank you for sharing that insight with us. I know, Dr. Mosallam, you and I touched on this a little bit. Does the vaccine have a tracking device? Is there a way that the government or a company can track an individual once they get vaccinated? And again, here in Dearborn, we serve a large refugee and immigrant population. This has come up again and again. Folks, have a lot of fear about sharing information and how their information is going to be used. Can you touch on that a little bit?
Yeah, thank you, Mona. And I've seen the same myths and the same falsehoods that are, perpetuated out there. And I can reassure everybody that that is not the intent of these drug companies. That is not the intent of the government or anybody else. The intent is to get us all out of this pandemic. So it's no conceivable way to be able to put a tracking device in a vial that comes this big. Then we actually stick needles into it to pull out vaccine, right, 10 times. So it's not each vial comes with one dose, right? It's 10 doses, some are 6, some are 5, and then we're actually administering it. So if you think about it, it's sort of a near impossibility. And then the intent is to provide medicine or a vaccine to help us curb the spread of this disease and to hopefully get us out of this pandemic. I took it. I have zero concerns about a tracking device or anything else. I have zero concerns, as Dr. McCart alluded to, about DNA changes. That's not how the vaccine works. That's not how the science is. We know exactly what the ingredients are and how this works. And it is not intended for any other purpose other than to help our bodies develop the immunity and the response necessary to fight off a virus, just like the flu, just like any other, vaccines that we give our children, several times in their early life, in their early lives, to make sure they don't get things like polio and measles and rubella, or tetanus. This is no different. And so I think that fear is unfounded. Please rest assured that it is very safe, but the intent is not to track us, right? The government has a lot more important things to worry about, and billions of people out there that are trying to get this vaccine. It's for our health and benefit, not necessarily the government's.
Yeah, and I say if people are concerned about the vaccines, be more concerned about the cell phones. I mean, people care. Everybody's carrying basically a cell phone. The next question is, how much control does the government have in the creation of the vaccines? I want to touch on this a little bit because I am very pleased with the intake process, if you will. The data collection piece is very, very simple. Very, very minimal information is being asked. So I think that gives people a sense of relief. That the registration process is very simple, and the questions are again just demographics and health related questions. So I think that the state has done a really good job with that, and I think a lot of folks anticipate that they're going to be asked a large number of questions and detailed information about their lives when that's not really the case. So anything you guys want to touch on the intake process and the information that's being collected?
The main information that is needed, Mona, at the present time is for us to be able to track who has been vaccinated, not to track them because we want to kind of follow them or the government wants to follow them, but so that we are capturing it in our the person medical records, so that we are comfortable that there are enough people who have been vaccinated, or if they come back for another vaccine, or if they have some, certain things that we need to check on, or blood testing or things down the road. So really the information that is needed at the present time is minimal. And it is like we use it for any other vaccination to make sure that we have enough people vaccination. It is not tracking any individual to kind of make sure that the decision is made against that individual in a positive or a negative way in that respect. And with respect to I don't know whether the question also, whether people were concerned about whether the government had a say into how the vaccines were developed. The government had absolutely no say in how the vaccines were developed. These were done like any other medication, any other drug, in specific companies that are very well known to do that. And the only thing the government did is, like they do in many other areas, is they sometimes sponsor research, or they are able to kind of develop kind of funds to be able to do that in some of the situations. So there is no concern from that perspective.
Wonderful, thank you,
Yeah,
Dr.
Mona, if I can just add really quickly. So the government's role is as a regulator, in that their job is to ensure that there's high quality and safety. So that's what the government does, but it's not government people even who are asked to review that panel that Dr. Monkara referred to earlier, and that there's a panel of researchers, of scientists, of people who are experts in their fields who review the data that these drug companies collect, again, to basically allow the government then to say, yes, we've asked independent researchers, independent experts who say that this is safe and that people can take it. And so there's multiple checks and balances. And really in this sense, I can tell you, especially in this country, the efforts that the government is putting forth is to make sure that it's actually high quality and a safe drug vaccine that we're all taking.
Thank you, doctors. Could you still get COVID after getting vaccinated?
So I alluded to that. Maybe Dr. Monkara, sure, please take that.
For a couple of things. One, we know that the vaccine is not, so the Moderna and Pfizer are about what, based on the initial studies, about 90 to 95% effective. So that this means that there is a 5 to 10% of people who might not, who still will get the infection in that, despite the vaccination. We also know that there is a smaller percentage of people probably also who might get the infection, and we don't know it because we did not test in it enough. But what we are sure about is that the vaccines are very protective to people from getting a serious infection, from getting an infection that gets them into the hospital, from dying from the infection. Remember that when COVID hit us in April and May, a lot of people died of the infection. So this was not benign. This is not like a mild flu. This is a bad infection that people die of. So what we know for a fact that yes, you can get the infection after you've been vaccinated. As Dr. Musallam has mentioned earlier, this is why it's important until we have enough people vaccinated that we can continue to use the protective measures, to wear the mask, to social distance, because we don't want to carry that infection. Although we might not get sick if I'm vaccinated, but if I give it to somebody who has not been vaccinated, they might get sicker. When everybody has been vaccinated, or the majority of people has been vaccinated, the risks become less, and then we can lower our guards a little bit.
So there's some research that's been coming out recently about, so now we're starting to know more. The real world experience, right? Millions of people have been vaccinated thus far. Something like 70 million people, I believe, have received at least one dose. And the number of people who've actually tested positive for the disease is actually very similar to what has been reported in the trials, less than 5%. The vaccines are really showing that they are actually very, very effective against illness, severe illness, hospitalizations, and death. And for us, from 185,000 doses given, we have seen 48 people who actually did have a positive test of COVID. 45 of them actually, they haven't received their second dose. And so that's why it's really important to complete your series, in that one dose doesn't confer 100% immunity, obviously, or the 95% immunity. And so it's really important to make sure you take both doses if you're getting Pfizer or Moderna, because that's what the research and what the science tells us is you have to have both.
And you're not fully vaccinated until the 2 weeks after you get both vaccines.
That's correct.
Okay, we have another question. I want to be respectful of your time. We're probably going to be on for another 8 minutes. If we can tackle this. Do you believe there is another study out there around children receiving vaccines? I know Pfizer right now has been approved for 16 to 18 age group. I don't know if Johnson & Johnson is, or what's going on with the vaccines around the children. Can you guys comment on that? Anyone?
What I know is that Moderna has launched specifically a trial for children. At the present time, the recommendation is to vaccinate people 16 and above, as you mentioned, for Pfizer, 18 and above for I believe, Moderna. But there is a trial at the present time for younger children with Moderna. This is the data I'm aware of. I don't know whether Dr. Musallam or Dr. Shaman are aware of other data.
Yeah, I think I agree with Dr. Munkar. I think Moderna is already started. And I also know like Johnson & Johnson, they're just starting to start a trial, because as Dr. Musallam, Dr. Munkar mentioned, I mean, they have to go through like a lot of steps before approval, but Johnson & Johnson also is starting a trial, but we don't think it's going to be in the next few months, or, if it is happening, it's going to happen maybe later, after maybe most of the population will be offered the vaccine.
Wonderful. So I don't know if you guys have experienced this yet or not, but a lot of folks who took their first vaccine dose may be traveling, may not be able to get to that second dose. What are some recommendations for those people in terms of I know there's the time period, we usually tell them to come back a month later after Moderna, 3 weeks after Pfizer, and obviously Johnson & Johnson is one dose, but what are some recommendations around that?
So supply, obviously has been tight up until now, and What we recommend to people is don't plan travel until you get your second dose and you don't have that protection conferred to you. So travel has a potential for a little bit of an increased risk. And so one dose does not give you that immunity. And so don't plan on traveling until 2 weeks after your second dose. What has happened is that people have done this and they've received a dose, let's say in Florida, and then come to us and say, can we get a second dose? And the way the allocation is, the way the state, the government, federal government, right now, there's nobody can buy it. We can't purchase this, right? It's all federally mandated and it's done through the state, the government. So the federal government gives, allocates doses to the state, and the state then distributes based on a formula that they have. We can't get more. And so when we get a first dose, the state puts aside and says, okay, now we know that we've given you 100 first doses, we're going to send you 100 second doses. And so what you need to think about is that somebody else has received that second dose for that patient. We don't have it. And that's true of everybody else. And so people will run into difficulty in the near term, right? In the future, when vaccine supply becomes abundant, then it may not be an issue, but currently they're going to have a really hard time trying to get that second dose.
And we know that April 5th, it's going to open up to the general population 16 and older, regardless of any health issues or other issues. So, I'm hoping that we're going to be prepared and we're going to have enough vaccines for folks. It's been very exciting to see the amount of people actually coming out, but we also know that there is a number of folks who do have concerns and the hesitancy still remains. And I just want to thank you guys so much. This was amazing. You guys answered all the questions that came through the chat and through our Facebook and media page. Thank you for joining us today and providing your expertise and insight. And I want to thank our audience for joining us today and for having the faith and trust to join and listen and wanting to learn more. This webinar has been recorded and will be posted on our Facebook page and uploaded on our YouTube page as well. If you would like to receive a recording of this webinar, please again email Mona Beydoun. Her email is in the chat. I want to thank you guys once again, doctors. This has been phenomenal. I'm so happy that we are able to shed light on some of these issues to our community members and to everybody out there who's listening. Please go wherever you can to get a vaccine. While we see supplies right now, we experienced a limitation in supplies, this morning. Wherever you can get an appointment, please do. As Dr. Musallam shared, there's many, many different sites throughout the state, throughout the county, providing vaccines, and to our wonderful partners at Henry Ford Health System who've, done a phenomenal job and continue to be our partners and to be there for our community members. We thank you. Please continue to mask up and, avoid large crowds. Even though you're getting vaccinated, which is great, we want you to be safe and to continue to be safe out there. And if you have any symptoms, please get tested. Once again, thank you to our wonderful panelists for being here today, and thank you to our audience. I will leave it to you if you have any last minute thoughts for our audience, but I'm trying to just want to be respectful of your time. We went over 8 minutes, so I appreciate you, sticking around and being with us today.
Our message, Mona, is please stay safe. Vaccination, make sure you get vaccinated when it is, your turn and you are able to get it. And also continue to wear your mask, social distance, wash your hands. We'll have this behind us, but it's extremely important to protect our community, our loved ones, our healthcare workers who have been working for over a year now, taking care of sick people, to make sure that we follow these protective measures. Thank you.
Absolutely. Thank you. And for our viewers who want to get an appointment at Access, we are having walk-ins. No appointment is necessary. Our clinic is located at 6450 Maple Street in Dearborn, Michigan, 48126. If you have any questions, please call 313-216-2230. Thank you again for keeping our community safe and being there for our community. I hope you have a wonderful day. Thank you.
Thank you, Mona.
Right.
Salam.